I'm Colleen. I'm a flight nurse with the Royal Flying Doctors of Western Australia, and today I'm going to show you what my job is all about. Okay, so we're heading into the coordination centre, and this is the central hub where everyone gets tasked. So these are the guys that call us to task us for any job, any time of the day. We're a 24-hour service, just like any other health profession. So these guys are the coordinators, we call them. So they are in charge of tasking pilots, doctors and nurses as a crew. We work on a priority system, 1, 2 and 3. And obviously the priority ones are our first port of call, and they're really urgent for us to go and get them as soon as we can. This is one of the cots that we use to transport neonatal babies that are born too early all across the state of WA down to King Edward Memorial Hospital. For majority of flight nurses, we have to be midwives as well in order to look after pregnant and labouring women for preterm birth, any birth complications, and the neonates as well. This is some of the equipment that we use on the aircraft. These are ventilators to help people breathe. We also have monitors that we monitor people's blood pressures and their oxygen saturation, and we can also do things like ECGs and defibrillate if somebody ends up having a heart attack or anything like that with us. To be a flight nurse, you have to study your registered nursing at university, and then you also have to do a Bachelor of Midwifery as well. We also have a background in emergency usually, and a lot of people have their certificate in emergency or ICU to have the job as well. I did my nursing over 3 years and my midwifery took 18 months. However, you can do a dual degree now where you can do both nursing and midwifery together. So if flight nursing is something you think you might want in the future, I highly recommend the 4-year course where you combine nursing and midwifery together. There is also enrolled nursing, which is a TAFE course as well. Unfortunately, enrolled nurses aren't employed in a flight nurse capacity just because the scope of practice is much less for an enrolled nurse compared to a registered nurse. All right, so we're going to go out and have a look at the aircraft where we predominantly work as a nurse in the flying doctor service. So come have a look. To go airside, we have to wear these yellow fluoro vests so we can be seen by the pilots and any aircraft that might be moving around out on the tarmac. So we're all about safety, so we need to be seen at all times. So we're a 24-hour service. We're always in the air. We can be flying for a whole shift, which is 8 hours for the day or 12 hours overnight, and we can go to multiple different locations during that time. So welcome aboard. This is a PC-12 that we use at RFDS WA. So when I do my nursing, this is my emergency room and my office, I suppose. So this is as big as it is, and we can fit 2 patients on stretchers like we said, and we can also have someone sitting if we need to. We come across people on the best and the worst day of their lives, which is a real privilege, and it's really important to be part of that journey for people. Some of the cool stories I've had, we've rescued people off fishing vessels, we've been taken people with life-saving blood for hours and hours of flight, we've delivered babies on the ground. There's just so many things that we can talk about in this job. It's never the same day twice, and you're never in the same area twice. We cover the whole of Western Australia with RFDS, so you can end up anywhere. And there's some just really, really amazing stories that come through. And my favourite ones are when they come back and say, thank you for saving me, or thank you for helping my family member. And it makes you feel really special. Some of the challenges we face in flight nursing is we've got a really small work environment, and we're often at the mercy of weather. We're up really around 20,000 feet. We have a sat phone that we can call for help, but if it's just you on the aircraft and you get diverted to a really serious case, then you've really got to back yourself and your assessment skills and your nursing skills and think outside the box to solve the problem and get the patient the best care that you can.